You reach for the water glass on your nightstand, half empty. You don't remember finishing it. You take a sip, swallow the little white pill that's supposed to protect your heart, and start your day. Just another morning. Getting older, right? Well, I need you to stop right there. Because that quiet thirst you just dismissed, that lukewarm dryness at the back of your throat, is not a normal part of aging. It is a signal. Now, the medication you just swallowed has been quietly making that signal harder to hear for months, maybe years. Your body has been trying to tell you one specific thing. By the end of this video, you'll know exactly what it is. Here's the better news. You'll also know the 4-step protocol that protects your kidneys without you ever having to stop your blood pressure pill. I'm Dr. Richard James. For nearly 3 decades, I've watched what blood pressure medication does to the senior kidney. Losartan, despite being one of the safer choices on paper, is quietly doing something to your body that almost no one explains. Not your prescriber, not the pharmacist who handed you the bottle, not the leaflet folded inside it. After 60, your kidneys are not the kidneys you had at 40. They filter slower. They concentrate urine less effectively. The chemical pathway your body uses to tell you to drink water, the renin-angiotensin system, is the exact pathway Losartan was designed to block. When you blunt that pathway in a 45-year-old with strong baseline thirst, almost nothing happens. The body adjusts. The signal still gets through. However, when you blunt it in a 70-year-old whose thirst sensor was already aging, you can quietly shut down the warning system entirely. That is where the trouble starts. I want you to think about what that means. Every time you swallow that pill, you are doing 2 things at once. You are protecting your heart. You are also turning down the volume on the one alarm your body has for low water. The research backs this up. A review published in Physiological Reviews on angiotensin and thirst confirmed that angiotensin II acts directly on a tiny brain region called the subfornical organ to trigger the urge to drink. When you block that signal with a drug in the Losartan family, that urge gets quieter. In older adults whose baseline thirst was already running at half volume, that drop can be the difference between staying safely hydrated and not. Here's the part that frustrates me the most as a doctor. There's a reason your doctor never warned you about this, and it isn't malpractice. It is something deeper, something built into how senior kidney function gets tested. Stay with me, because by minute 9 you're going to understand exactly why your last lab work missed this entirely. Here is what is actually happening inside your body. Angiotensin II, the chemical Losartan blocks, does 2 jobs at once. It tightens your blood vessels. It also knocks on the door of that tiny region of your brain called the subfornical organ, which tells you that you are thirsty. When you block the first job, your blood pressure drops. That is the point of the medication. That is what it is supposed to do. However, when you block the second job, the knock on that door gets quieter. After 60, that door was already harder to hear. Have you ever noticed that since you started this medication, you actually feel thirsty less often? You go longer between sips. You forget to refill the glass. You finish the day and realize you only drank water with meals. That is not your imagination. That is your hypothalamus, doing exactly what the drug is asking it to do. I want you to sit with this for a moment. Older adults on angiotensin receptor blockers report measurably lower thirst sensation compared to matched controls. Even at the same level of hydration, they are not less thirsty. They are less able to feel that they are thirsty. Their bodies still need the water. The alarm just doesn't ring as loud. This is exactly where most people make a critical mistake. They think, well, I'm not thirsty, so I must be fine. That is what your body has trained you to believe for 70 years. Before the medication, thirst was a reliable signal. After the medication, it is no longer the same signal. Nobody told you that the rule changed. Now you understand the mechanism. Understanding it, though, is not the same as catching it in time. The next part is where most seniors lose months of kidney function without ever knowing it was happening. Here is the cascade. Your thirst sensor is quieted. You drink a little less than your body actually needs. Day after day, week after week, your blood volume drops, just slightly, just enough to matter. Then one warm afternoon, or one bout of a stomach bug, or one extra dose of a diuretic, and that just enough tips into not enough. Your renal blood flow drops. Your filtration rate drops with it. By the time the lab catches it 3 months later, you've lost weeks of kidney function you cannot get back. This is what doctors call acute kidney injury. The medical literature is direct about this. Research on antihypertensive treatment and renal function in elderly patients during high ambient temperatures has documented exactly this pattern. The combination of an ARB, a senior kidney, and a single hot week is enough to push filtration into the danger zone. The elderly are the population most often hospitalized for medication-related acute kidney injury linked to dehydration. A Dutch hospital review of preventable medication-related kidney admissions found that timely medication adjustment around dehydration events could have prevented a significant share of those hospital stays. The injuries were not random, they were patterned, they were predictable. I had a patient, I'll call her Linda, 72 years old, retired schoolteacher, on Losartan for 8 years, no complaints. One hot Saturday in July, she spent 4 hours in her garden pulling weeds and replanting tomatoes. She drank water, by her count, plenty. She felt fine when she came inside. By Monday morning, her creatinine had jumped 40%. She didn't feel sick, she just felt tired. Her doctor told her she had probably just gotten a little dehydrated. Drink more water and come back in 6 weeks. Here is what nobody explained to her, though. Her creatinine had already been drifting up for 2 quarters. The lab was just catching the moment that the drift crossed a line. The damage started long before Saturday in the garden. Saturday only finished what 2 quiet years had begun. This is the part of the conversation that almost no doctor takes the time to have. Because standard blood work only measures the floodwater after it has reached your living room. By the time creatinine moves, your kidneys have already been calling for help for weeks. The one signal that would have given you a 2-week head start, thirst, was the very thing the medication was muffling. Linda is not unusual. Linda is the rule, not the exception. Every summer, in every clinic that sees seniors on ARBs, the pattern repeats. A hot weekend, a creatinine jump on Monday, a patient who feels normal while their kidneys quietly take the hit. Linda's story sounds like a summer story. You might be telling yourself, I don't garden. This doesn't apply to me. Yes, it does. I had another patient, a 68-year-old retired accountant, who got a routine stomach bug in February. 2 days of mild vomiting. 1 day of low-grade fever. The kind of thing he had recovered from 100 times. He kept taking his Losartan because nobody had told him to do otherwise. He sipped water when he felt like it. By the end of the week, he felt fine. 3 weeks later, his routine lab work came back with a creatinine bump and an eGFR drop that put him from stage 2 to stage 3 chronic kidney disease. The bug took the water out. The Losartan kept his thirst quiet enough that he never replaced it fast enough. The kidneys absorbed the difference. This pattern does not need a heat wave. It needs a window. A stomach bug is a window. A travel day with little water is a window. The medication is the fixed variable. Hydration is the lever. So now you know the mechanism and you know the consequence. I can already hear what you are thinking. Doctor, are you telling me to stop my blood pressure medication? No, I'm telling you the opposite. Because there are 4 things you can do, starting tonight, that protect your kidneys without you ever changing your prescription. Stay with me. Before I give you those 4 steps, I want you to look at something with me. There are 6 quiet signs your kidneys may already be asking for help. If even 2 of them sound familiar, this video was made for you. Sign number 1 is the simplest. You wake up and the inside of your mouth feels like a dry envelope. You always blamed it on sleeping with your mouth open. It is not your mouth. It is your kidneys quietly telling you they spent the night working harder than they should have. Sign number 2. Your urine first thing in the morning is the color of strong tea, not pale straw. You tell yourself everyone's morning urine is dark. That is partly true. However, if it is still dark by the second trip to the bathroom, that is concentrated urine. Your kidneys pulling water out of every drop because they don't have enough to spare. Sign number 3. By 4 in the afternoon, you have a dull, low headache behind your eyes. You reach for coffee. The headache softens a little, then comes back stronger by dinner. That is not a caffeine cycle. That is a hydration cycle. Your brain is one of the first organs to register a small drop in blood volume, and that quiet headache is often the only complaint it knows how to make. Sign number 4. You stand up from your chair and the room gets briefly bright at the edges. You catch yourself on the armrest. You laugh it off. Getting old. That moment is your blood pressure dropping faster than your blunted reflex can correct, because your blood volume is running below the line. Doctors call it orthostatic hypotension. Your body calls it the warning your kidneys wish you'd listen to. Sign number 5. The skin on the back of your hand, when you pinch it gently, holds its shape for half a second before flattening. In a well-hydrated body, it snaps back instantly. That little delay. That is the same dehydration your lab work is not yet showing. Try it right now while you watch this. Pinch the skin on the back of your hand, lift, and count. If it does not snap back inside 1 beat, take note. Sign number 6 is the one most people miss entirely. Your fingertips and your toes feel cold even on warm days. That is peripheral vasoconstriction. Your body is sacrificing your hands and feet to keep enough blood reaching the organs that matter. The kidneys are at the top of that list. If you nodded along to even 2 of those 6, you are exactly the person I made this video for. In the next 3 minutes, I'm going to give you the protocol. Before I do, there is one more thing I need you to understand. Because if you skip it, the protocol will only work halfway. Now, I know some of you are still thinking, I am hearing this in my head as I say it. Doctor, are you telling me to stop taking my blood pressure medication? No, I am telling you the opposite. Losartan is, for most people over 60, one of the safer choices on the cardiology shelf. I am not asking you to stop it. I am asking you to take it more carefully. To the rest of you who are thinking, I already drink plenty of water, I hear you too. However, this is not about the quantity in the glass. It is about the signal that tells you to lift the glass in the first place. That signal is what the medication blunts. Once you understand that, the protocol I am about to give you in the next 2 minutes makes perfect sense. I had a patient, a retired engineer, the kind of man who tracks everything, who was drinking 80 ounces a day by his own meticulous count. His creatinine still drifted. 8 weeks on the protocol I'm about to share, his lab work came back to baseline. He never stopped Losartan. He just stopped trusting his thirst as the trigger. He set a timer instead. The timer never forgot. So here is exactly what I want you to do, starting tonight. Step 1. You are going to stop waiting to feel thirsty. From this point forward, your thirst signal does not get a vote, your kitchen clock does. 6 small drink anchors a day. When you wake, with breakfast, mid-morning, mid-afternoon, with dinner, and 1 hour before bed. Not gulps. 8 to 10 ounces each. That comes out to roughly half your body weight in pounds, converted to ounces, spread across the day. A 160-pound person, 80 ounces. A 140-pound person, 70. Sip slowly, do not chug. Your kidneys handle a steady stream far better than a flood. If you struggle to remember, set a soft alarm on your phone or kitchen timer for each anchor for the first 2 weeks. After that, the habit carries itself. Step 2. Take your Losartan at the same time every day, with a small amount of food and a full glass of water. Anchor the pill to the morning hydration step. Same time, same glass, every morning. The point is not to change the drug. The point is to make the medication itself the cue for water. Most people who fall behind on hydration fall behind because they forget. Tie water to a habit you already have, every morning, without fail, and you remove forgetting from the equation. Step 3. Make a plan with your prescriber, in advance, not during a crisis, for what you do on the day after you've had a stomach bug, on the day of a fever above 101, or on the day before a long stretch in summer heat. Many doctors will tell you to hold the pill for 24 hours in those situations. Some will say no. The right answer is your doctor's, not mine. Have the conversation now, while your kidneys are calm. So when the hot day comes, you already know what to do. Write the plan down. Tape it inside the medicine cabinet door. Tell one family member where it is. Step 4. At your next appointment, ask for a urine-specific gravity test. Not instead of your creatinine, in addition to it. Urine-specific gravity moves days before creatinine does. It is the early warning system your standard lab panel does not have. Write that exact phrase down. Urine-specific gravity. Bring it to your next visit. If your doctor agrees, you have just bought yourself a 2-week head start on a problem that today has no early signal at all. That is the whole protocol. 4 steps. No prescription changes, no supplements, no special equipment. Just a different way of treating water, as scheduled medicine, not as a response to thirst. I want to give you one more thing before we close. A short list of moments that should put you on alert. The times your kidneys are quietly most vulnerable, even when you feel completely fine. Save these. Maybe write them down on the same sticky note as your hydration anchors. The first is travel. Long car drives, plane flights, or any morning where you skip your usual breakfast routine. Cabin air on a plane runs around 10 to 20% humidity, drier than the Sahara. You lose water through every breath. You forget to drink because the cart is slow, and because Losartan has muted the signal that would have reminded you. Treat travel days as automatic protocol days. Drink 12 ounces before you leave the house. Drink another 12 once you arrive at the airport or gas station. The second is illness recovery. Most people remember to hydrate when they are actively sick. They forget to hydrate in the 5 days after. Your blood volume is still rebuilding. Your kidneys are still catching up. Treat the week after a flu, a stomach bug, or a fever as a full hydration week. Stick to the anchors. Do not skip the bedtime one. The third is medication changes. Whenever your prescriber adds, removes, or changes a dose, your fluid balance is recalibrating. New diuretic, higher Losartan dose, added blood pressure pill, even a new antibiotic. Each one is a moment to pay closer attention to color, energy, and that pinched skin test on the back of your hand. Tonight, when you set that water glass back on your nightstand, I want you to remember something. You are not getting old. Your body is not failing you. There is a signal that was being quietly muffled. Now you know how to hear it again. If you know somebody over 60 who is on a blood pressure pill, a parent, a sibling, a friend you've known since high school, share this video with them. You might never know it, but you could be the reason their kidneys are still working 5 years from now. I'm Dr. Richard James. Next week, I'm covering the second blood pressure medication that does something even more surprising to seniors after 65. So if you want that one when it lands, stay close. Take care of yourself tonight. You've earned a good night's rest. I'll see you in the next one.